I came in thinking it's a better career and the best decision. But then I'm thinking, is it really? Because after going to university and studying, do I really have to go through this?
Victoria Kamfula only became a nurse 3 years ago, and already she's questioning whether it was the right decision. She loves her job, but says her workload is unsustainably high, and money left in her pocket at the end of each month too low.
It's a struggle. It is. It is. And then you're continuously in debt, you know, and that's what I'm saying, for how long is this going to go? Because it reaches a point whereby we're all humans and you get tired, you know, you get fed up. If there's no change, then maybe I would have to think about a different career, because I can't keep doing the same thing and there's no change. Then what else can I do? Because my children come first, and I don't want to end up homeless.
Today, nurses in England, Wales and Northern Ireland announced the biggest strike in NHS history on the 15th and 20th of December to demand a pay rise. The NHS is one of the few areas where the government committed to spending more in the last budget. But union bosses argue that the pay rise offered to nurses in the summer needs to be increased too, because staff are struggling to make ends meet and demoralised nurses are leaving the profession in droves, which they say is compromising patient safety. Nurse vacancies in England are currently at a record high. Over 40,000 left active service between June 2021 and this June. That's equivalent to 1 in 9 nurses. The Royal College of Nursing want a 17.6% wage hike after salaries saw a real terms cut of 20% since 2010. But the government say the £10 billion price tag is unaffordable.
And I think most people watching will recognise that that's obviously unaffordable, and that's why I'm pleased that the Health Secretary is sitting down, talking to the union, and hopefully we can find a way through this.
Nurses would still do emergency and life-preserving care on strike days, but routine appointments would likely be cancelled. Marie Morgan has been waiting for 4 years for a hip replacement. Her mum is worried about the knock-on effect of strikes.
Well, with her not having this operation, she's daily in pain. And she's miserable, you know, it's not fair on her. I want my daughter to have this operation, so this is important for me, for them not to strike.
But this may just be the start of disruption in the NHS. Midwives and health workers at Unison and Unite are currently being balloted on whether to strike. Physiotherapists and junior doctors will soon be too. A mass walkout at the height of normal winter pressures may yet force the hand of a government determined to cut back.
Well, joining me now is the General Secretary and Chief Executive of the Royal College of Nursing, Pat Cullen. Good evening. People might be confused hearing Rishi Sunak and the Health Secretary saying we are talking to the nurses and we are prepared to keep talking, but you are nonetheless calling strike action. Why?
Yes, well, I actually think that the Prime Minister is confused as well. I don't know who's giving him his updates, but I can make it very clear tonight that there are no formal negotiations happening with government. I have tried now for 2 weeks solidly to try and get the government to get into negotiations with the Royal College of Nursing, and that has fallen on deaf ears. And they have chosen strike action over negotiations, and that's very clear. So the Prime Minister isn't being given the correct information as far as the college is concerned.
Now, in Scotland, strike action's been avoided by a pay deal that is much less than nurses wanted, but is an average of about 7.5%. Would that avoid strike action in the rest of the UK?
Well, strike action has not been avoided, and it has been suspended pending the negotiations. And I think that just sends a very clear message about the reasonableness of the profession of nursing, and indeed this Royal College, that when you get around a table with us and start to talk to us about the conditions that our nurses are working in. And we just heard from that wonderful nurse, Victoria, what it's like about feeling that dreadful feeling that she may become homeless. Then what happened in Scotland was they got around a table and started to talk meaningfully with us. Yeah. Now, of course, any offer will be put to our members, our nurses that voted in their droves, in their thousands and thousands for strike action. First time in 106 years This is something no nurse takes lightly, and being a registered nurse myself, we feel this very, very clearly
But
every
just to be
single day.
clear, if Rishi Sunak did what Nicola Sturgeon has done, would that stop the strike action on the 15th and the 20th? Would you put it on hold?
Get around a table and start talking to us and start meaningful negotiations. Absolutely meaningful negotiations.
Yeah, and is
None of us want to
7.5%
take
as an
strike
average
action.
meaningful from your point of view?
Look, I certainly have no intentions of negotiating on the airwaves. What I will do, night or day, I'm available to come to Westminster, or indeed they are very welcome in my office to start negotiations on behalf of our profession. My door is wide open to do that at any time. I'm certainly not going to do that on the airwaves.
Pat Cullen, thank you very much indeed for your time.